Hello, everyone. This is Dr. Spencer. We're going to be doing a brief overview and introduction of child and adolescent mental health, with discussing some various topics related to that. I just wanted to share some statistics with you too, that I was fascinated by when I read them. National estimates are that the demand for mental health workers will exceed supply by 250,000 by 2025, with 96% of all counties in the United States facing a shortage of mental health prescribers. And that's from the American Association of Psychiatric Nurses. So I thought that was pretty interesting. And the field of child and adolescent mental health is relatively young still. The American Academy of Child and Adolescent Psychiatry has been around for a little over 60 years. And there's still a staggering need for child and mental health practitioners, like I shared, um, in this country. Um, so, I also think it's important to bear in mind that the assessment of children and adolescents is a privilege to care for those, because parents are typically parents. Sometimes it's courts or other places, foster parents, but typically they're bringing their most precious, vulnerable persons into you to be trusted with their care. And another thing to consider is that it's not just the child that you're treating; it's the whole family unit typically. So remember that when you're caring for children, adolescents, it's not just the child or the adolescents; it's typically the whole family that you're having to work with and treat. Um, Mental health, as we talk about, is not simply the absence of a mental disorder. Children, and this is from the CDC, children who don't have a mental disorder might differ in how well they are doing. And then children who have the same diagnosed mental disorder might differ in their strengths and weaknesses. And we want to think of mental health as a continuum, and helping children to better cope and deal with issues that they're struggling with. So I'm going to share some more statistics with you. Nearly 20% of children and young people aged 3 to 17 in the United States have a mental, emotional, developmental, or behavioral disorder, and suicidal behaviors among high school students increased more than 40% in the decade before 2019. Mental health challenges were the leading cause of death and disability in this age group, and these trends were exacerbated during COVID, as we all know. And then from 2016 to 2019, the rates of emergency department visits um, related to mental health increased. You can see that there. And then the rates of this age group, there was a slight dip in 2019, but in 2018, the rate was 976.8 per 100,000. And that was a 25% increase from 2016. Mm. And then 50% of children age 8 to 15 experience a mental health condition do not receive treatment. There's a variety of reasons for that. And then boys 2 to 8 were more likely than girls to have a mental, behavioral, or developmental disorder. But adolescent girls, age 12 to 17, there has been a sharp and sustained increase in depression since 2009. In addition, more than one-fifth of children living below 100% of the poverty threshold had met behavioral or developmental disorders. Age and poverty level affected the likelihood of children receiving treatment for anxiety, depression, or behavioral problems. I'm sharing some theories again with you that you want to know. You will see these again. You'll see these on boards. You'll use these in your practice. So there's Freud's psychosexual stages. There's Erik Erikson's stages of human development. I'm not going to go through all these. You can read these. Piaget and Sullivan, again, you will see these again. Important to know also in practice as you're caring for children, adolescents, and even your adults. So I'm not going to go into everything in your readings, but I'm just going to kind of give a brief overview of the process of assessment and diagnosis. All this is in your text. You can read through this, but remember that it involves a family, the whole family. It's a collaborative treatment, right? In order to be successful, you want to maintain a demeanor towards parents and children that is approachable, culturally sensitive, and collaborative, right? And you're working with the whole unit, and obtaining information from parents, teachers, school social workers, therapists, and other relevant people. And also be sure to include culture, because that's important as well. For our diagnostic assessment, screening tools, there's a variety of those that you can use. I can't even go into all those. That could take us a whole 7 weeks to talk about, and we probably wouldn't be able to get through them all the variety of screening tools. But depending on what you're seeing someone for, or child and adolescent for, it would be what tool you're using. And then interviewing depends on the age and intellectual ability of the child or adolescent. You want to be sure that you're, when you are interviewing, that you begin interviewing the family first, right? And then followed by the child or adolescent alone, and then the parents alone. And then the final feedback is where you share your observations, diagnostic assessment, and treatment. That bringing everybody in back. Again, you're including everyone in the plan, so that everyone is on board. And like I said, your book goes into all of this. A really good book with how to interview and do stuff. So please be sure to read through all of that. And then I just wanted to share some kind of when you can see the emergence of psychiatric disorders in children. You have there's autism spectrum kind of up here, separation anxiety, mutism, phobias, OCD, generalized anxiety, kind of relates to the age, ADHD, OCD, depression, although we've seen some depression in younger kids too. So it's a nice little overview. And then treatment planning. I just want to be sure and emphasize that you're getting consent for treatment, and I would recommend informed consent from a parent or legal guardian prior to starting any medication whenever possible, and also getting assent from the child that you're going to be working with. There are a variety of effective treatments. Evidence-based group therapy, family psychotherapy is recommended. And then I provided you a list here from the American Academy of Child and Adolescent Psychiatrists that talks about different therapies. There's parental guidance to help guide parents in the treatment of their child or adolescent. And then psychopharmacology and medication can be part of the treatment plan, but not alone. And you always want to be sure that, if you're using medication, that it's the appropriate diagnosis and treatment for that particular child or adolescent. And again, as I shared, getting consent. And you want to be as thorough and accurate in your diagnosis as possible before starting any medication. And medication should be part of a comprehensive treatment plan, not alone. I definitely always have my children in psychotherapy, even if it's for ADHD. I just think it's that important. There are some ethical considerations to consider when working with children and adolescents. You need to acquaint yourself with mandatory reporting requirements for your state. and HIPAA, that, what HIPAA says and what you have to follow. Here I'm sharing with you, am I my child's personal representative under HIPAA? You'll have a link to this document, but you want to read through this, be aware of this, and be aware of your state's laws and requirements. And then there's also a little decision tree. When can parents access information about their a minor child's mental health treatment? That's important to know. So again, review this information. Also want to talk about mandatory reporting. I'm going to be providing you guys with this document. You want to stay up to date, though, on your state requirements. And this is current through 2019. This is the latest version I found. So you want to check that frequently, but it has some good information. As PMHNPs, we are mandatory reporters. So we are required to report suspicions of abuse or neglect to the appropriate authorities. Both federal and state statutes include stipulations related to mandatory reporting. And as a PMHNP, you're responsible for following all relevant statutes in your state of practice. So please update yourself with those. This lecture would be way too long if I were to try to go into every state and try to cover those. But this document here provides some nice guidance, but just, again, talk to whoever you need to talk to about your state requirements when it comes to mandatory reporting. And I always, when I start a visit with every new patient, I always say, a general welcome. And then, I always give them the little spiel that everything we talk about is private or confidential, that I don't share that with anybody unless it involves them wanting to harm themselves, harm somebody else, or the harm or abuse of children, the elderly, or disabled. And if there are a child or any abuse of themselves towards themselves or others, because children can also be abusing others, and we'd have to report that too, right? Okay. So again, here on this slide, you see I've provided links, and you'll have these with where these documents can be found. Confidentiality. Again, there are limits to confidentiality. I've provided a link for you here, but I think it's best to always make that known up front. Obviously, if a child or adolescent is threatening to harm themselves, that limits their confidentiality. Because you have to protect them if they're being threatened by someone else of harm or they're being harmed, then that's obviously going to limit their confidentiality as well. I want to take a moment to speak about prevention and promotion of mental health. That's something as nurse practitioners and PMHNPs we should really advocate for. There's a preponderance of evidence that shows that if we can prevent this mental health disorders in early childhood or some of these things, then we have less of that as they get older. And there is a lot of studies that show that chronic and severe mental illness has its roots in childhood, adolescence, and early adults. We know that poverty and unemployment and lower socioeconomic status are the most impactful risk factors affecting the mental health and physical health of children, adolescents, and young people. And interestingly, chronic poverty before the age of 5 significantly predicts later childhood symptoms of anxiety and depression, independent of their present poverty state. So, say they're 10, and they weren't living in poverty, but they are now. Less risk for anxiety and depression. So mental health promotion and prevention is crucial to optimizing mental health for children and youths. And then promoting positive mental health issues is just as important as preventing and treating mental health. So just something to think about and some of the ways you can become involved with that, looking at, pregnancy prevention and care, early childhood interventions, um, parenting skill training, so important, um, community-based interventions that you can do to help, um, and then community interventions, like I said, classroom interventions, policy interventions, all ways that you can become involved with prevention and promotion of mental health in our young people. And this was a nice little slide that I found from youth.gov, which is a great website, by the way. I encourage you to all go there. And if you do have an interest in working with children and adolescents, I do recommend that you get some additional training as well for that, because I do think it's more specialized. Um, and you want to be as uh, prepared to help this group as possible. So youth.gov is a great website. So, in summary, caring for children and adolescents, it's a great privilege with great responsibility. Like I said, consider additional training, careful assessment, diagnosis, and treatment. Remember, counseling. Medications may never even become part of your treatment plan, especially for our young ones, but they are there. You want to get informed consent. Confidentiality is important, mandatory reporting, and then considering mental health prevention promotion, getting involved in your community and advocacy in some way. I've given some resources here for you. These are not exhaustive, but by any means, uh, there's a child and adolescent measurement initiative. There's I did this program years ago. It's an awesome program. It does cost. It's called KISS, Keeping Youth Safe and Secure. Takes you through a bunch of mental health disorders with treatment. Really good program. It's for the Ohio State University. I highly recommend this program. It does cost though. There's the American Academy of Child and Adolescent Psychiatry. You do have to pay to become a member, but they do have free things that, and CMEs and stuff that you can do. There's the National Alliance of Mental Health. They have a toolkit and stuff for youth. And then there's National Institute of Mental Health. And there's information for youth as well. And then there's some of my references. So again, I hope this was helpful. Just a brief overview of what to expect for in caring with our children and adolescents.